In this chapter, we will discuss with you the most common renal pathologies we may encounter in daily ultrasound routine. The first chapter deals with abnormal position or shape of the kidney. Not real pathologies, but it can be difficult to locate and assess the organs. Our first variation is the so-called horseshoe kidney. The kidneys are merged together at the lower pole, and we can find a parenchymal bridge ventral of the aorta. And this has a shape of the horseshoe, and that's why it's called the horseshoe kidney. Sometimes this can be associated with other genitourinary anomalies. So what does a horseshoe kidney look like in ultrasound? Starting this video clip over here, the right liver lobe, the right kidney. And as you can see, the lower pole is not clearly visible, and the kidney is not getting smaller during the lower pole as in normal findings. The next clip shows us the aorta over here, the spine over here, and we can detect the structure, hypoechoic. This is the parenchymal bridge of the horseshoe kidney. This is where the two kidneys are merged together. The next clip shows us the left side of the horseshoe kidney. The aorta, the parenchymal bridge, and the left part of our horseshoe kidney over here. Another not uncommon variation is the double kidney. The double kidney shows a kidney longer in diameter with two pelvic-calcial systems and a parenchymal bridge in between. It is normally asymptomatic, but can sometimes be associated with other abnormalities of the urinary system. Usually, this is an incidental finding without any symptoms. Here we can see a left kidney with two systems, two pelvic systems over here, the parenchymal bridge, and another finding here are two renal cysts. Same on this picture. This is not a correct longitudinal view, so the kidney is not really larger, but in this view we can easily distinguish the two renal pelvic systems and the parenchymal bridge in the middle. Urinary tract stones in ultrasound are normally highly echogenic structures. And this can make it sometimes difficult to distinguish them from the also hyperechoic renal pelvis. We've got acoustic shadowing in calcified stones, and sometimes we even can see the stone, only a hydronephrosis is a pointer to urolithiasis. In this image, we can see in the center of the kidney a small hyperechoic object. As you see, not easily to distinguish from a renal pelvis, but between these two markers, we can see it over here, a renal stone with acoustic shadowing, clearly seen over here. The next image shows us an also common condition when there's urethral-lithiasis. We've got hydronephrosis. As you can see, the renal pelvis is not hyperechoic anymore, but it's echo-free in the middle, which points to a congestion of urine over here. This leads us to our next pathology, to hydronephrosis. Hydronephrosis is a condition which can be easily displayed and assessed with ultrasound. In hydronephrosis, the renal pelvis is dilated with urine. This condition can be acute or chronic. It can occur in both kidneys or only in one side, and the patient can have symptoms or be asymptomatic. Normally, acute forms tend to be symptomatic, and chronic forms can remain undetected for at least some time. Urinary retention of any etiology can cause hydronephrosis. Quite frequently, an enlarged prostate leads to urinary retention and also to hydronephrosis. Of course, passing stones can block urine flow and can also cause hydronephrosis. A tumor of the urinary system, but also of neighboring structures, can lead to interference with urine flow and also lead to obstruction. Congenital abnormalities of the urinary system can also be a cause for hydronephrosis. And even normal pregnancy quite often can lead to mild hydronephrosis, which ceases after childbirth. Acute hydronephrosis can lead to flank pain, which is often also radiating into the groin area. Depending on the position of the urinary obstruction, there also can be urinary retention. For example, when there's strictures of the urethra, a urethral stone, or prostate hyperplasia. Depending on the cause for hydronephrosis, there can be hematuria and signs of renal failure in the blood tests. Chronic forms, especially when they are mild, can also show no clinical symptoms at all. We've got different degrees of hydronephrosis. Some divide in 3 degrees, some in 4. We use the classification of 4 grades. Grade 1, only dilated renal sinus. Grade 2, renal sinus and minor calyces dilated. Grade 3, renal sinus, minor and major calyces are dilated, the parenchyma already getting a little bit smaller. And grade 4, a totally dilated renal pelvis and the atrophy of the parenchyma. Here we got a picture of hydronephrosis, grade 2. You see dilated renal pelvis and also the minor calyces show a dilatation. This is a video clip of hydronephrosis. You can clearly see anechoic, the cause of fluid in the center of the renal pelvis. And also here. This is again a picture. This is hydronephrosis grade 1 to 2. Again, anechoic in the center of the renal pelvis. And this is grade 3 to 4, a really dilated renal pelvis with a lot of fluid in it, anechoic, and the parenchyma over here already getting smaller. Another video clip. So you can see hydronephrosis, and what you could detect here was that somebody was palpating. If the patient is feeling pain in this area, sonopalpation of a kidney with hydronephrosis. Another picture and a clip. And this time we can also see the urethra is dilated at the uretero-pelvic junction. And we can detect hydronephrosis grade 3 and a dilated uretero-pelvic junction over here. There are some differential diagnoses to hydronephrosis. The first one is the so-called ampullary renal pelvis. This is no pathology, it's a norm variant. And it's a kind of baggy-looking renal pelvis. So in the center of the renal pelvis, we have some anechoic small structure. And it can be a differential diagnosis, especially to hydronephrosis grade 1. And the difference in between is that in ampullary renal pelvis, the urethra is not dilated, whereas in hydronephrosis grade 1, the urethra is also dilated. Let's see this in a picture over here. So we can see the renal pelvis over here, and the ureteropelvic junction, and in ampullary renal pelvis, the urethra is not dilated. In the next picture, we see a hydronephrosis, and the urethra is dilated. In this case, also the calyces are dilated, so this would be a hydronephrosis grade 2. But when we distinguish hydronephrosis grade 1 from ampullary renal pelvis, the most important fact is that in ampullary renal pelvis, the urethra is not dilated. There are situations when it can be difficult to distinguish hydronephrosis grade 1 from ampullary renal pelvis. What can help us is to refer to the clinical symptoms of our patient. Are there any signs of obstruction of the urinary tract? Is there any pain? And the next thing we can do is that we can repeat our examination and compare it to the first one to see if hydronephrosis is getting more or even being less or staying the same. Another differential diagnosis are pelvic renal cysts. Sometimes renal cysts central in the pelvic can mimic hydronephrosis. But also in this case, the urethra and the calyces are not dilated. And often in the second plane, for example when we turn in the transverse plane, the cyst can be identified.